Good morning. It's an absolute pleasure to join you at this important conference. I'm very sorry I can't be with you in person. We tried very hard to visit at this time of year, but COVID-19 means we have to wait a little longer. But I have been at one of these IUG conferences before, and I'm delighted to see that the title this year is looking at medical education. I also thank the conference organisers, in particular Dr Kamis Alessi, for asking me to give this a short plenary on a topic that's very close to my heart. Transformational learning is something which is, I think, at the heart of much of what we do or we should do in medical education, but it can be helpful just to define what we mean by that and to think of it a little bit more in terms of theory and of practice, because I think this is an absolutely essential paradigm in medical education. I've had the privilege of teaching and learning in many different academic medical environments, including my own alma mater in Aberdeen, but also working with universities in Edinburgh and India, in Gaza, in Sudan, in Uganda, and you see some of the undergraduate, the postgraduate, and the diploma students that I've had the privilege of teaching in these pictures. And of course, right at the center, students from IUG. If we are to really change practice, if we are to allow people the opportunity for transformative learning that encourages them to look at and challenge their own values and ways of working, and in so have a degree of empathy that allows them to interact, particularly in clinical scenarios, to the position, to the experience of the people that they're caring for, the patients and our families. And it begs the questions, and I'm going to touch on these in my brief plenary. What are the values that underpin medical education? And I'm going to ask you about your own values in a moment. What do our patients, family, and society want? How do our curriculums address holistic learning? We know, in fact, that many people want a much more holistic approach. And what difference will this kind of approach make? You see this beautiful archway. This is the ancient university that I was fortunate enough to study medicine. And this is the Latin inscription you see there. This university is more than 500 years old, and in fact was one of the oldest, is the oldest English-speaking medical school. I know the Arab world had medical schools long before. Initium sapienti timor domini. We were to walk under this archway as we went to our classes. I don't know if any of you have studied Latin or have worked it out, but it means the fear of the Lord is the beginning of wisdom. The fear of God is the beginning of wisdom. And I think that was an important value for me as a young medical student. So I come to that question. Dr. Fadel Naim has often said in my hearing that he wants to train healers, not just clinicians. So the question I put to you is, what are your values? And what values do you want to see in your young clinicians that you're training in medical education? I hope you'll just jot one or two down. And then as we look and see some of the values that students have expressed, you can see how those gel. And you can think about how you might facilitate learning. This is going to be more an overview, but I hope I'll give you some pointers along the way. And this is a mnemonic, a word diagram of some of the values that can be helpful, designed for palliative care. I'm a palliative care physician, but I'm also trained in internal medicine. And I've had the privilege of working in global health in different cultures and contexts. And I think it's remarkably similar, the values that are really important, both to us, but also most importantly to our patients and our families, to have excellent clinicians for sure, who are evidence-based and are experts, but also who know how to communicate, who can show empathy and compassion, who treat people with respect, who understand the importance of listening and of caring, who seek justice and do that with integrity, as we've mentioned. All of these things, important values. And I think these words kind of summarize what I'm trying to say. We want competent-based curriculums, of course, but we also want values-orientated education. And that's where transformational learning comes in. The global medical education world has been looking at what do we need to do going forward? And they've come up with these 3 C's. We need creativity, we need people to create knowledge, curate knowledge, and we need people with compassion. We want people to come through our educational systems as change makers with creative, innovative thinking. We don't need to expect them to know everything nowadays, but we need them to know how to find out what's important and how to make decisions. You know, not just knowledge, but decisions based on judgment and wisdom. And we need people with compassion, people that go that extra mile. Here's another equation. This was being outlined by the WHO in their documents looking at the importance of compassion as a quality indicator. And they've said that an equation for our time may be awareness of a challenge or a problem, empathy, some understanding of the experience of that person and some identifying with them, and then some action. And all of those 3 things means compassion. So compassion is not a soft thing. It's a very fierce, powerful, costly thing, but it's also an essential part of our transformational learning. So this theory is not new. We've been looking at experiential learning, what makes professional practice. We've been looking at different models. I worked with Colin Coles many years ago when I was a postgraduate. And I think I learned the value then of looking behind and below what we're teaching. And that if we concentrate only on skills and knowledge, we're only catching the very top layers, if you like, what you can see above the waterline. But we're missing out on all of the things that change practice. Let me give you an example. In my area of teaching, if you believe that someone who without education, someone with poor language ability is not able to understand medical concepts, then we will have a very paternalistic attitude to how we practice medicine. And we probably will not be very good at listening or explaining in words that they can understand, because that's a values-based, a judgment and a value and an assumption. But if we believe in the equality of everyone and that it's our responsibility to find the words, to get rid of the jargon, to communicate effectively, then we'll find a way to do it. So it's not actually the knowledge that's important, it's the value that underpins that knowledge. I'm sure you could think of many examples from your own practice. Some of you will be very familiar with educational theory. I'm sorry, this is a complicated diagram, but if you're familiar with the Kolb learning theory, there's a number of experiential learning theories, which takes people on a cycle where you have to complete a number of different aspects of the cycle, from watching or observing to thinking, which is the theoretical framework, to the practical, which is the doing, and then maybe more of that reflecting and intuitive making sense, which is the feeling. And we can use these tools to help ourselves and our learners look at their styles of learning, encourage them to learn in the way that is most natural, but to complete the cycle. And as teachers, we can use this to make sure our curriculums are balanced and we bring in ways of learning that allow people to be flexible, allow them to develop new concepts and new experiences, but to complete that cycle of learning. So this is something that's very familiar to us in education and in practice. But where I think transformational learning takes us just one step, it builds on that framework, very much builds on that framework, but it takes us into this concepts of critical thinking, goal setting, reflection. We do this in our curriculums. I've seen it done in Gaza, inquiry-based learning, clinical learning, project-based, problem-based, clinical scenarios. These all encourage us to look at things from the point of view of a complex scenario. And in fact, it's this complexity and even allowing people to struggle a bit with it. How do I make a situation? How do I decide how to balance these ethics? How do I actually engage with the very big reality, and you face this every day in Gaza, where your resources are limited and there are external controls that don't allow you to do what you feel you would like to do for your patients, for your community. How do we practice in that environment? And importantly, how do we embrace failure? Now, I don't mean failure as in not being competent, but allow people to see that if you take some risks, some of them you're not going to do well in. And that's a process of wisdom, isn't it? And overall success. I'm concerned that sometimes we are so constrained with marks and MCQs and sort of a tick box system that we don't allow people to try something in a safe environment. For example, in my own university, I lecture in Uganda at the moment. There is a tendency to do teaching rounds, but to give marks in the postgraduate regime and environment. My concern there is I might teach communication to someone and they may make a real mess of it in that controlled environment. But out of that is going to come probably huge amounts of learning. People that say, I now know what I was doing wrong, I'm going to do it better. That's getting it wrong in order to learn from it. And we must be careful not just to mark the knowledge, but to mark the learning that happened in those encounters. And the other thing which I think is very important is address helplessness as well as acknowledge excellence. Perhaps in palliative care, we're very used to that. We can't do everything for everybody, no matter the resources we have. How do we deal with that? How do we communicate effectively in the basis of that? How do we help make ethically sound decisions along with patients and families? And how do we handle our need to save people versus our need to be part of that caring environment where we bring our excellence and we bring our empathy and we bring our communication skills and we bring our striving for the best care, but we acknowledge the limits of that. Think for a moment of a teacher who's inspired you and reflect why. This is a picture I love. It's taken more than 20 years ago with one of my mentors, Professor Rajgopal, who's known as the father of palliative care in India. Very gracious man, very humble. You would see him sitting on the floor in a very simple home in rural Kerala. All around his office was the word listen. All around the clinic was the word listen. And I learned a phenomenal amount from his personal characteristics, but also the way in which he led teams. And I learned a lot of my cross-cultural working with Rajgopal. So what was it that changed that inspired you? It'll be different things for different people, but many times it's a value, isn't it? Compassion, I think, was the value I learned from Professor Rajgopal. And this beautiful quote from Khalil Gibran, it's wisdom in a teacher if they take you to the edge of your mind, the threshold of your mind, not simply what they know. So how do we help people learn and carry on learning and push their learning, experiential learning, values-based learning? And don't forget our patients as our best teachers. This young boy we met on a ward round, he had a leukemia. He had that very difficult experience of having traveled out with Gaza for treatment without his parents, and then had come back, but unfortunately disease had relapsed. We're there with medical students. They're struggling. How do you talk to a young boy about these sorts of issues? So in fact, I said to Ahmed, today you're the teacher. Why don't you tell us what it's like? What are the sorts of questions you would like us to answer for you? Or what are the sort of things you would like these young medical students to know so that when they're doctors, they will know how to speak to someone like you? It was a very profound and very moving interaction that did deal with some difficult issues about cancer, about shortened life expectancy, but also dealt with his favorite football team, which was Manchester United. I think that's an experience these young students will not forget. Here's some more examples. This was a postgrad. This is a postgrad in internal medicine. In Uganda, we have brought in holistic care and palliative care into the curriculums for undergraduate and postgraduate. And in particular in internal medicine, we have been really encouraging these young internal medicine physicians to grasp these skills. And as one of my cardiology colleagues said, put palliative care in first year because they are better cardiologists if they've learned how to speak to patients holistically. And this is a young man who's not going to be a palliative care physician. He was on his way to be a gastroenterologist, but he said this: I now see the patient as a person and not a disease. I don't avoid difficult conversations. I don't order unnecessary investigations, really important. I see them as part of a family and I do holistic care. And most importantly, it was not like that before. Let's help our youngsters undergo these transformations where they take their phenomenal intellect and their knowledge and their skills, but apply them in these kinds of way. Otherwise, we're going to simply have kind of robotic practitioners, not true healers, as Dr. Fadel Neem would say. Here's another example from Uganda. This is a link nurse. We train nurses from internal medicine, from surgery, from other areas to have these holistic skills. And this is a young surgical nurse saying, I thought there was nothing I could do for these patients, but now I realize there is. And why has she realized it? Because the training changed her. It changed her attitude. Isn't that interesting? That's a values-based change, not a knowledge change. She's seeing the patients differently, and she's seeing herself as a clinician differently. And another nurse on that similar program talked about, why do we do this now? Because we're inspired. We're not doing it for necessarily an evidence-based reason. That's good, but inspiration. Maybe that's what you thought of when I asked you about the value of your teacher. Couple more examples just to show that we can do this in different ways. This is an online program we did with 15 countries and more than 2,500 students, run from India. I was one of the faculty organizing and writing this program. And we were teaching healthcare workers across these countries about the management of COVID-19, particularly when there was multimorbidity. And what really struck me was how often these young healthcare workers chose to talk about the challenges they were having, the ethical dilemmas, how they felt, being overwhelmed, feeling helpless. And those were the things that were really stopping them doing their best job as clinicians. Not so much knowledge. There was some knowledge. We taught them symptoms, for sure, symptom control. And we taught them some other skills. And I love this comment. It said, thank you to the experts for giving us such divine service. It makes each one of us better humans. Isn't that interesting? What does it mean to be fully human? And how do we maintain our humanity in our medical education and not lose it? And I think transformational education is one way we do that. So let me come to Gaza. And it's been a real privilege to be teaching undergraduates for the last few years. And when we finish our teaching week, we talk about what values, what has been learned. And of course, this is within a curriculum that is very holistic, that is about healers. But I was really struck this particular time about these values. Just listen to them. Love, compassion, hope, mercy, honesty. That was in relation to communication. Justice, humanity, joy, dignity, respect. These were the values identified by these medical students that we had been speaking about in palliative care. And of course, those are relevant to all of medicine. And another student said, this represents humanity till infinity. And that's a great concept to think of. And that's a transformational concept. We've been teaching online, and even online, we were able to explore some of these values. So it is possible. It's much better face-to-face, but it's possible online. And these female medical students talking about using our brain, but also our hearts. That's interesting, isn't it? Very, very important. That's a transformational learning. And you'll recognize some of you, a graduate from IUG. This is with his mother, with her permission, because she used to tell him every day. I met her because I went for makluba at their home. And she used to say to him every day, please talk to every patient today as if they were your mother. That's a values-based learning. And it was the mother who was the teacher in this circumstance. So let us incorporate transformational learning. Let's mentor it in our youngsters so they will in turn go on to do that. Let's be relational. Let's, yes, invest in skills and organizational development and leadership, but underpinned by values. Let's embrace change and change makers, even if it's uncomfortable. Let's encourage risks within a safe environment and learning. Let's be generous with one another and kind as we learn together, and maintain curiosity and wonder. That's one of the most creative aspects of learning. And I would always say, feed your souls. Make sure we ourselves, if possible, come into those learning environments with ourselves ready to engage in that mutual learning experience. And finally, a letter that we wrote to the Lancet in relation to palliative care in humanitarian settings. But I think it has resonance here, particularly for palliative care, which for me offers such an opportunity for this because of the issues of hope and meaning and purpose. And it talks about suffering, reminding us of our mortality and our humanity, of the need for a compassionate response, and the need to, yes, do all we can to cure, to prevent disease, to manage it effectively, but not to forget easing of suffering and upholding of dignity. Thank you for this opportunity. I wish you well in the rest of the conference. We'll be teaching online quite soon with our faculty once again, and I very much hope we'll also be able to visit in the near future. Thank you.